Hello, everyone, and welcome. Thanks so much for joining us this evening to learn about our Mental Health Counseling Master's Program. My name is Renat Arif, and I work in the Graduate School of Education Admissions Office. And presenting our session, we have Dr. Amy Reynolds, who's one of the faculty in the program. So we're excited to have her join to talk more about the program. And we will have a dedicated question and answer at the end. But if you think of any questions, you're welcome to type them in the chat. I will be checking it throughout the presentation. But we will also be sharing the slides in this recording. I know there might be a lot of information to catch up on or take notes on, but so don't worry about jotting everything down. We will be sharing everything after this session. So I'll go ahead and pass it over to Dr. Reynolds.
Good evening, everyone. My name's Amy Reynolds. My pronouns are she, her, hers, and I am a professor in the Graduate School of Ed. I'm also department chair of Counseling School and Ed Psych, and I'm here to kind of talk to you about the mental health counseling program. So I've got some slides I'm going to share, and if you have questions along the way, don't hesitate. I have my chat open, and I can kind of respond, or you can save them till the end. All right. So, as I was starting to say, I'm the department chair. I'm also currently the acting program director for the mental health program. We're in a transition now. Currently, we have an in-person program, and we're working on developing an online program as well. So this is my contact information. I'll give it to you again at the end. So our mental health counseling masters prepares you to provide counseling directly to clients in a variety of settings. We have 4 core faculty, counting myself: Wendy Geiger, Tangela Roberts, Sandro Sedano. That are our core faculty. We'll be hiring some new faculty this year, so that will be expanded. And then we have other important staff that help run our program. Importantly, we have, and all of them are Jennifer. Can you believe that? I mean, what are the odds of that? But Jennifer Dexheimer is a clinical coordinator. So everybody, in order to get a degree in mental health counseling, get licensed in the state of New York, you have to do an internship, a clinical internship. Jennifer Dexheimer is our clinical coordinator, and she helps students figure out how to get placements and does all the paperwork behind that. And students, we'll talk about that in a minute, but she's just integral to the success of that part of our program. Then we have Jennifer Austin, who, if you've expressed interest in the program, you may have run into her. She's academic advisor extraordinaire for all the programs in our department, knows a lot about all of them. And then we have Jen Roslyn Bates, who's the assistant to the chair and really kind of takes care of the office. So all of us together are here to make the mental health counseling program as strong. A little piece of trivia is that this program started in 2005. That's when I was hired at UB, actually, to contribute to that program. So that program has been here this will be its 20th year coming up. So we've been accepting students, graduating students, and expanding the mental health counseling field for the past 20 years. So today we're going to talk about UB in the program. We're going to talk about the course schedule and what the class is. We're going to talk about internship requirements and program requirements and admissions. If you're just thinking and you haven't made up your mind yet, hopefully this information will fill out sort of your thoughts about the field. When we get to the Q&A, I'm very interested in helping answer questions. I may not know all the details, particularly about the internship aspects, but I'll do the best that I can. So some of you are UB students, I saw in the chat, and some of you are just in the area. So, a large number of UB students are post-baccalaureate, right? Almost a third, right? And we are considered SUNY's flagship university. UB is a great place to work. It's a great place to go to school. It's an affordable school because it's a state school, but it has a great reputation because it is an AAU, which means it's a highly esteemed research institution, which means some of the best scholars in the world work here and do research here. And And that's good for our students because they're learning from the best. We're a research intensive university, and we strive to not only impact the world, but particularly to impact our local environment more and more. So we are the largest and most comprehensive public university. There are other obviously really big stellar research institutions in the SUNY system, which is over 64 campuses, including Stony Brook and Binghamton, but not one that's quite as comprehensive as UB at every level. And it's hard to believe we have a lot of programs, 300, I think, and is what it says here, which is a lot. So we have an on-campus master's program, as I said, and it's a rigorous program. It is approved by the state of New York in order for students to get licensure in mental health counseling. It's 60 or 61 credits. It's typically completed in 5 full-time semesters. And mental health counseling internship is in our local community, right? So it's not something that is outside of here. So the expectation is that you will be on campus for all of your classes. I think students in the mental health program are allowed to take their electives online and maybe one other course. But other than that, every other course is an in-person course. So we are a licensure qualifying program, which means in the state of New York, if you graduate from a licensure qualifying program, all you have to do is to pass the national exam, and you get an automatic license, right? Of course, after you pay your dues, right? But if you were to try to say, got your program here and you wanted to get licensed in California, they may have different requirements. And so you could still become licensed, but you might have to do a couple state-specific things. We are also an accredited program. The purpose of accreditation, particularly in professional programs, is to ensure and protect the public safety, and so that there is some quality control of what programs are doing, right? And so there are 2 options for accreditation. We are accredited by the Masters in Psychology and Counseling Accreditation Council, or MCAC. And what they do is they come in order to be accredited, they evaluate your courses, your university, your faculty, and they deem you as meeting the requirements and the criteria set out by that accrediting body. We have other accredited programs within our department who are accredited by other bodies. Like I teach in a doctoral psych program, and we're accredited by the American Psychological Association. So being in an accredited program means that your program has a stamp of approval from an overseeing body, and I think that is a good thing. This is straight from state law. In order to be licensed as a mental health counselor in New York State, you need to be of good moral character. I think that's basically meaning they check if you have some kind of criminal record, at least 21, meet educational experiences, educational requirements, experience requirements in terms of like an internship. You must meet examination requirements. You must pass the national test and complete any coursework or training around child or elder abuse. So most states, before you get licensed, whether you're a psychologist, a social worker, or a counselor, you have to know what state law is in terms of being a mandatory reporter. If you are working with a child and they report abuse, or an elderly person and they report abuse. So you're going to have to learn, you might likely have to attend a state course that just tells you what the law is and what your requirements are as a mandatory reporter. Because as counselors, psychologists, or social workers in the state of New York and across all states, the expectation is that when we get that kind of information, it's our job to protect children, and we have to do what's expected. So by getting your degree here, you will meet all these requirements and can go straight forward to licensure, as I said. And when you get this, you should be able to click on this link, and that will take you right to the state ed department that kind of reiterates these same points. So in order to get licensed and get approval as a program, we have to do cover these 13 areas, either in terms of experience or content in your courses. And so you have a wide range of content that you need to have as a mental health counselor. You need to understand human growth and development, and understand there's a developmental component to life and to therapy. You need social and cultural foundations. You need, everybody is required to take a multicultural social justice class so that you are able to work effectively with people who are culturally different from you. Of course, you have to learn about theory and practice, psychopathology, group dynamics, career development, assessment and appraisal. Counselors, as a rule, do not do testing. That is left for psychologists who have additional training because, doing an intelligence test is a very specialized skill to have. And so it's hard to do that in a master's program. You also have to take a research and program evaluation course. And even though our students don't go on to be researchers and some do go on to get PhDs, I guess we identify as a scientist practitioner program, which means that we believe what is found out in science through research should affect how we practice therapy and counseling with the people we work with. Likewise, we also believe that what we do in the therapy room should impact and affect the direction in which research is done. And so we have that sort of scientist practitioner perspective. So we want you to understand research, if for no other reason, so you can continue to educate yourself even after the degree, read journals, read books, and attend conferences so that you can understand the things that you are learning about. Of course, we want you to have a firm grasp of ethics, which is obviously very important. Understanding mental health counseling as a field. Also, like I said, recognition, reporting of child abuse training, and then 1 year, and that's about 600 clock hours of supervised internship in mental health counseling. So this is how we map up against those things. You'll see on the right are the courses and experiences that we have and how that connects with the requirements on the left from the state. So we're pretty much lined up group to group in that regard. In terms of course sequencing, we'll kind of go over this. We have both a standard, which is 5 semesters, or an accelerated approach, which is 4 semesters. And that just depends on, whether you want to take classes over the summer. For some students, they want to get done, so they're good with doing summer classes. Other students feel like they need a break. You have to make your decision as to whether you're going to be standard or accelerated by the end of your first semester, because really going into the spring, because if you don't take classes that summer, that first summer between your first and second year, then you basically will have to do 5 semesters. So this gives you an understanding of the courses that you're required to take. You'll see that it adds up to 60 or 61, depending on what electives that you take. And you get 2 electives. And you can take those courses within GSE, the Graduate School of Ed, or you can take them elsewhere. You take them outside of the Graduate School of Ed, you have to get the permission of your advisor. So you'll see there's a wide range of courses that are, compelling and interesting, and you'll learn a lot. Now, if you're going to do it accelerated, again, you will take 4 courses a semester, but then you'll also have that summer where you'll take 4 courses in between. So it's pretty intensive. But it is a way to get out sooner and to, and to truncate sort of the cost of the degree, for sure, into 4 semesters as opposed to 5. So as a program, while we don't have a set theoretical orientation, I would say generally we are person-centered. Much of, we have a series of master's programs in counseling, and then we have a PhD in counseling and school psychology. And so, like much of the field of counseling and psychology, there's a strong cognitive behavioral orientation. We also strive to engage in trauma-informed care. So, which means that as we attend to people, even if we don't know that they've experienced trauma, we interact with them and engage with them and do interventions in such a way that we assume that they may have been exposed to traumatic experiences. And so we want to be attentive to that in what we do. And we also strive to have a multicultural and social justice focus in all of our courses. You'll notice, and you can check on this on our website, sort of what the faculty interests. They range from everything from career development to mindfulness and self-care to multicultural issues. And then in the department as a whole, it gets even broader in terms of anti-bullying and supervision and all sorts of content areas. But you can definitely check out our website to find out what our faculty are interested in researching. And I will tell you that if you're interested in potentially thinking about a PhD, or you just were involved in a lot of research as an undergraduate and would like to continue that, there are certainly lots of faculty that engage students in their research, and I encourage you to look and see what faculty are doing and reach out to somebody who is doing research in an area that's of interest to you. Upon completion of your MS, you're totally responsible for applying for licensure and submitting your own materials. Once you get your degree from us, Jennifer Austin, who is sort of the academic counselor, certainly assists because you'll need information from the registrar and all that in order to apply, but it's really the onus is on you. You'll have to get an official UB transcript, which has the essential program code, so that when they look at your materials, they'll know that you're from a sanctioned program in the state of New York. If you want to be licensed, if you think, well, I'm going to eventually move to Massachusetts, I would encourage you to check out what those requirements are earlier rather than later. You'll have to make sure. Now, sometimes states have different cutoff points for the national exam. So everybody takes a national exam, right? This is true in psychology as well. And so there's cutoff points. States have different cutoff points. And so say you pass it in New York, but you're like, oh, I might want to move to California, and their score is higher. You probably want to retake the exam right away while you're still remembering the knowledge, so that you get the highest score possible that would allow you to meet the criteria in any state. We may not meet the criteria requirements in every state, but if you go to this website, it will let you know in advance. So, internship. So you take 12 credits or 600 hours of internship. That's 20 hours of internship per week. Now, many of our students are work full-time. And by full-time, I mean like 30 hours and up. Some of our students also work part-time. There aren't that many of our students that don't work at all, right? Because, this is a real world, and, people have bills to pay and all that. So if you have a full-time job, it's hard to figure out how to do, a full-time internship, which is 20 hours a week. But luckily, you have a couple semesters to figure that out. And most of our students are able to figure it out. You have to get whatever site you want to do your internship at has to be approved. It has to be an authorized setting. It has to have the appropriate individuals. You have to be able to be supervised by someone who's of an appropriate degree. It doesn't have to only be a licensed mental health counselor. It can be a psychologist or social workers. And you have to be in a training situation. They can't just say, you can do an internship here and we're just going to have you work here and we're not going to really train or supervise you. That's not appropriate. We want to make sure that your internship is an educational experience. We have students that have done their internships in hospitals, community health agencies, substance abuse treatments, some counseling centers, a whole variety of places where our students have been placed. Sometimes school-based programs, family centers that are affiliated with various school systems or districts. Some people do attempt to complete their internship at their current workplace. And so the response to that is maybe. You have to basically propose that somehow how your internship experience would be different than your day-to-day job. So maybe you're working in a mental health setting, and you're doing one thing. Well, you can't count your job as your internship, but you could maybe do hours in another part of your say you're working in a hospital, another part of the hospital that's not related to your job, and count that as your internship. You'd still be in the same building, etc. So it's not that you can't do it, but you have to go through an approval process, and there has to be supervision. And who supervises your internship can't be your boss. So if you can kind of meet those criteria, you may be able to do internship at your current workplace if it is an appropriate mental health setting. Students find their own internship. Jen Dexheimer is there to provide support, to give suggestions, but she's not going to go out there. Usually what happens is that students, they're given a long list of places where we've had people go locally. They send emails. This usually occurs within a certain time period that placements are looking for interns. And we have long-standing relationships and a really positive reputation in the community. People like our students. They feel our students are strong. And so they're not hesitant to take on our students. That being said, if there's a type of site or a specific site that is not sort of on our list or we've never had anybody there before, we're certainly open to involving new sites. They just have to go through an approval process, not just with us, but the state ultimately. Because what happens is that while you're on internship and you're a full-time student, UB pays your liability insurance. So we have to make sure the place where you're at is an appropriate placement, right? And so we go through that process. So if there's an area that you're particularly interested in, we can maybe try to help you find it if there's not one that's in the area. For example, at the PhD level, we've had a couple students that want to do sex therapy and work with people that come to therapy to address sexual concerns or issues. There's nothing in the immediate Buffalo area, but there is in Rochester. So we've had students found this place, and then we had it approved, and now it's a site that other students can use as well. So in the spring of your first year is when you do all the legwork to get your internship, which you will start the following year. And it's an active process that you need to be engaged in. You can't just be passive, but again, we provide guidance and support. Then once you have your site there and you take an internship class, which is required by the state. So you have on-class meetings, in which case you get actual supervision, group supervision, with your peers and with a faculty member. You typically are required to write a case study, conceptualizing a case, and then deliver a presentation on that one or another one where you talk about and engage with your peers about clinical work. In addition to that class, you have to have supervision with an on-site supervisor for a minimum of 1 hour a week. Depending on where you're placed, you may have some group supervision because maybe if they have several supervisees or students, interns there, they might have some group supervision or some didactics, depending on where you're placed. But at minimum, you have to have an hour of supervision because we realize that you're just beginning and that you need a lot of support and guidance, and you're going to learn a lot during this period, and it's helpful to have people there to help you process it, to not only talk about your successes, but to figure out how to deal with the challenges that come in being a therapist. So again, not just anybody can be your supervisor. They have to at least have a master's degree or a PhD. They have to be licensed and registered in New York State in one of these counseling-related professions: licensed mental health counseling, licensed clinical social worker. So not just an MSW, they have to be licensed or have equivalent qualifications. And they need to have at least 3 years of full-time experience or part-time equivalent. So you can't have someone who just got their degree be your supervisor. You need to have someone who's had a little bit of experience, which makes sense, right? You should be supervised by somebody who's not a novice and still figuring it out. Because again, no matter how hard we work at educating you in 5 semesters, you're going to leave our program with a lot more to learn. Heck, PhD students are in training for 5 years, and they leave having more to learn, right? That's, to me, one of the wonderful things about this profession is I feel like I'm a student all the time, not in the bad way of being a student in terms of homework, but in that I'm always a learner, and I really love that, and I find that exciting. So you're required to do 600 hours. At least 240 or almost half of those hours must be directly interacting with clients. The rest can be indirect, like supervision, case notes, those kinds of things. So you can see the difference between direct and indirect. So sometimes when you get on an internship site, it takes a while to get those direct hours. You got to learn the culture, learn how to do the paperwork. You have all of these things to learn. So at the beginning, you won't be getting a lot of direct hours. But then once you get acclimated to the environment, boom, 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 you'll start to get direct hours. Occasionally, some students are done more quickly because they're able to get to clients right away. And other placements, sometimes you have to work a little longer, extend it into the summer to get all the hours that you need to meet the licensure requirements. So in terms of admissions, you have to have a bachelor's degree. A 3.0 is the minimum cumulative GPA. You typically write a personal statement of intent. We ask for a resume so we can kind of see your background, and then 3 letters of recommendation. We encourage you to get letters from faculty or professionals. We don't want letters from your therapist, your dentist, your neighbor. We want professional letters. You can laugh at those examples, but we've had people use those letters before. We don't require the GRE scores anymore, and the application deadline is February 1st. In order to be admitted, you have to meet the program eligibility requirements. That involves submitting a program application. There's a non-refundable application fee, and upload unofficial transcripts from any undergraduate or graduate academic work. As I said, there's a statement of intent. This helps us see who's a good fit. So we ask your reasons for becoming a mental health counselor. We want to know if you've been involved in efforts to engage in cultural diversity or social justice. And then we ask any experiences or volunteer work that's related to counseling. And this kind of gives us a sense of each person. Don't have to be a lengthy story, just 500 to 1,000 words in the one, and the smaller ones are 250 to 300. So those are part of the admissions requirements as well. Minimum of 3 letters. The references hopefully will talk about you as a student, talk about related leadership experience, talk about you as a person. Your references will be contacted directly by UB, so you don't have to get their letter and then send it to us. We go directly to them. You just give us their contact information, and it becomes part of your application. I will say, because this goes without saying, I think, some people who are asked to write letters say yes, and then they forget. So sometimes you may have to remind them nicely that the due date is coming. Then after we receive all the materials, we do a pre-screening. We get a lot of applications. We cannot interview everybody. We get too many for that. But a good number of our people in the pool will get an interview. We use a rubric and we look at students holistically. There's no one piece of evidence or data. Say you got a 3, just barely made the cutoff, a 3.0. we don't necessarily say, well, you're lower down the list than somebody who has a 3.8. We don't think about it that way. We look at holistically, what can you bring the profession? What is your fit with UB? We try to look at you as a whole person. A lot of people go on our wait list because guess what? We make a lot of offers, and for a variety of reasons, students either change their mind, um, decide to go somewhere else, etc. And so it's not uncommon for us to go deep into our wait list. And we don't want to, say we're trying to get 24 students. We know we lose a bunch of people, but we're also afraid. We don't want to say offer to 40 people because what if we had the 1 year everybody said yes? That would be a crazy year. So, we do it in batches. So we typically make offers to 30-ish people. And then depending on how many people say yes or no, then we go into the wait list. So don't view that as a bad thing. A lot of people from the wait list get accepted. Career options. Lots of places you can work. Private practice, group practice, which is now called independent practice. You can be involved in places that do research like hospitals. You can adjunct teach in master's level programs, depending on the institution. You can work for insurance companies, businesses as employee assistance programs. There's lots of things that you can do with this degree. I think it's a pretty versatile degree. You can do one thing. So say you work in community mental health for 10 years, and then you decide, oh, I want to have a private practice. You can do that. So we are now at the Q&A part.